The lack of clarity in this process has been creating frustration for a lot of people who are eager to try to protect themselves from COVID. Here's David Goins.
On a day where no one should be standing outside, long lines stretched outside this Tarrant County clinic for those waiting for the COVID-19 vaccine. This is the 1B population, Texans over 65 or those with chronic conditions, now eligible to receive the vaccine if doses are available. The Tarrant County Health Department says it quickly went through its allotment of 1,100 doses on Thursday. In this first week of 1B eligibility, we have heard from many North Texans frustrated trying to find a vaccine provider.
The major hospitals that were on the DSHS list as being points to go get it, they didn't even know how they're going to handle 1B when they do get vaccines for 1B.
On Thursday, the State Department of Health Services updated its guidance for those seeking a vaccine, asking the 1B population not to show up at a site without an appointment, instead to sign up online with any vaccine provider.
We're still operating at very low efficiencies.
Dr. Peter Hotez, a vaccine scientist at Baylor College of Medicine, says the rollout hasn't gone smoothly because the state so far has depended on individual pharmacies to try and meet overwhelming demand. That's led to clogged phones and overwhelmed pharmacists.
We're really busy today.
Instead, Hotez says, as more vaccine doses come in larger quantities, mass vaccination clinics, much larger than what we're even seeing today, will need to become the norm in the new year.
So we're going to have to create, small tent cities of where we can vaccinate, thousands and thousands of people on a daily basis and just make it less fussy and less onerous.
In Dallas, I'm David Goins.